say the biggest challenge for nursing, and it's really the biggest challenge that's for nursing everywhere, is how we staff our ECMO units. And so just this morning we've had a discussion in the nursing forum about how different units around Europe are staffing their units. With units in Europe looking at upstaffing, so they have a 1-to-1 ratio, where units in Great Britain are now looking at how they can work less than a 1-to-1 ratio due to the short staffing in nursing. So this presents a challenge in how do we keep our patients safe, how do we progress them on ECMO as quickly as possible. So some really, really good conversations about do we train different professions to help us in the nursing field, and how do we go forward with this. So I'd say that's the biggest challenge for nursing and ECMO at the moment. So I think there's developments in nursing education, and I think what the pandemic has done is made everyone realise that we need to educate not only at ECMO specialist level, so we have these really ultra ECMO nurses who can manage a circuit and can troubleshoot a circuit in the clinical area of critical care, but also our nurses at the bedside, about training them to make sure that they are safe looking after looking after the patient on ECMO. And so I think it's just about how we plan going forward, how we resource going forward, and what is the aim of ELSO is to try and standardise the approach to not just nursing education but all education. So about endorsing courses to make sure they all reach the same standard. So around the world, wherever a patient goes on ECMO, they can expect exactly the same high standard of care from the nursing team that provides it. Yeah, we do, and I think more and more this is going to be adapted in other countries following COVID, because it's a very good way for the nurses to progress, because it gives them a clear progression through the stages. It's also good for the patients because they know there's always someone really safe at the bedside. So the ECMO specialist is an internationally recognised qualification, whereas the ECMO trained nurse is a more local qualification. And hopefully that will be adopted more widely. So again, it's all about having the same standard of care wherever you put ECMO, wherever you are in Europe, in the world.